video we'll study about dermoid cyst. So first of all, what is a dermoid cyst? So dermoid cyst is a cyst or a swelling that lies in the subcutaneous tissue. हम लोगों को पता है कि स्किन होता है, स्किन के नीचे सबक्यूटेनियस टिश्यू होता है, स्किन को हम लोग क्यूटेनियस लेयर बोलते हैं, तो क्यूटेनियस के नीचे सबक्यूटेनियस. So dermoid cyst is a swelling or a cyst that lies in the subcutaneous tissue. तो बोलोगे इसको dermoid cyst भी क्यों बोलते हैं? Because dermoid का मतलब something like skin, so it is formed or it is present in the subcutaneous tissue which is like skin but not skin. Okay, so what is dermoid cyst? Dermoid cyst is a cyst or a swelling that lies in the subcutaneous tissue and not in the skin. ठीक है. अब second question is कि dermoid cyst कितने types के होते हैं? So you basically have 4 types of dermoid cyst: sequestration dermoid, implantation dermoid, tubulodermoid और teratomatous dermoid. तो sequestration dermoid क्या होता है? Sequestration dermoid is a dermoid that is formed by the sequestration of some ectodermal cells into the deeper tissues during embryonic development. Embryonic development के समय, if some ectodermal cells sequestrate into the deeper layers, it is called as sequestration dermoid. तो implantation dermoid क्या होता है? Implantation dermoid is when there is implantation of the epidermal cells into the deeper tissues, but this is not during the embryonic development, rather this is an acquired cause, suppose due to a pinprick. तो pinprick हुआ, and when there is implantation of the epidermal cells in the deeper layers, it is called as implantation dermoid. Now what is tubulodermoid? Tubulodermoid is when there is non-obliterated portion of the congenital ectodermal duct. तो उस non-obliterated portion को हम लोग बोलते हैं tubulodermoid. And what is teratomatous dermoid? Teratoma मतलब something which arises from the totipotent cells. So the cyst or the dermoid we develop from the totipotent cells, and it is all the 3 layers derivatives: ectodermal, endodermal and mesodermal. For example, it can have muscles, it can have cartilage, hair, tooth. That is called as teratomatous dermoid. तो आपने जान लिया कि dermoid क्यों बनता है, कितने types का होता है, dermoid होता क्या है. Now you have to know what will be the patient problem when it comes with you. So obviously the patient will give a history about the swelling and you will describe the swelling as you describe any other swelling. ठीक है. तो position, size, surface and margin in skin बहुत important है. Now where is the position of the dermoid? The dermoid is usually lying in the midline and along the lines of the embryonic fusion. Size क्या होता है? Usually globular होता है. और surface और margin कैसा होता है? Smooth surface, well defined margins होता है. ठीक है. So present in the midline and the lines of embryonic fusion. Okay, as a doctor, what will you see? As a doctor, you will do fluctuation test, trans-elimination test, and test for mobility and fixity to the underlying structures. The fluctuation test क्या होगा? Usually positive है. Trans-elimination test negative होता है. Test for mobility, so it is fixity to the skin. Negative. क्योंकि dermoid cyst तो skin के साथ fixity होता ही नहीं है ना. Dermoid cyst तो तुम्हारा skin के below होता है. So fixity to the skin is negative. And test for the underlying structures, तो ये भी negative होता है because dermoid cyst bone के साथ या muscle के साथ fix नहीं होता. Okay, so doctor, you are going to perform these tests, and as the patient will give the history of the swelling, and you will see the position, size, surface, margins. Okay, अब आपको diagnosis करना है. तो dermoid cyst का diagnosis will depend कि dermoid cyst present कहाँ पे है. So for that you have to know what the common sites where dermoid cyst can be present. It can be present in the scalp, it can be present in the forehead, it can be present in the lateral margin from the orbit. Okay. See, it can be present on the center of the forehead, lateral angle of the orbit and the scalp. Suppose it is present in the lateral angle of the orbit. Then you have to see कि कहीं intracranial spread हुआ है कि नहीं. ठीक है. Hence, you will do X-ray of the skull, both in the AP view and the lateral view, to look for any bony gap in the skull through which the cyst can extend intracranially. अगर कोई bony gap नहीं है, then simple excision of the cyst will work. ठीक है. और अगर बोनी गैप है या इंट्राक्रेनियल टेंशन हाई होने का चांसेस है, देन यू विल डू द सीटी स्कैन. ओके, सपोज इंट्राक्रेनियल एक्सटेंशन है, तब आप क्या करोगे? यू विल डू द एक्सिजन ऑफ द सिस्ट बोथ एक्स्ट्राक्रेनियल एंड इंट्राक्रेनियल पार्ट बाय यूजिंग एन ऑस्टियोप्लास्टिक फ्लैप और बाय क्रेनियोटोमी. मतलब अगर इंट्राक्रेनियल एक्सटेंशन नहीं है तो सिंपल एक्सिजन ऑफ द सिस्ट कर लो. अगर इंट्राक्रेनियल एक्सटेंशन है या इंट्राक्रेनियल प्रेशर ज़्यादा है, विच यू कैन सी इन सीटी, then you have to do both extracranial and intracranial part resection or excision by raising the osteoplastic flap or by craniotomy. Now, there are 2 more things which you have to know. First, is dermoid cyst a true cyst? So yes, dermoid cyst is a true cyst. Why? Because it is lined by squamous epithelium with hair follicles, sebaceous glands and serous glands. Okay. तो false cyst क्या होता है? False cyst वो cyst होता है which is not lined by epithelium, but dermoid cyst is lined by squamous epithelium. Hence, it is called as a true cyst. And one more important thing, what is the content of dermoid cyst? The dermoid cyst contains a toothpaste-like material which is formed from desquamated epithelial cells with or without hair. Okay? It is a toothpaste-like material which is formed from desquamated epithelial cells. तो इस वीडियो में हमने क्या पढ़ा कि dermoid cyst क्या होता है, dermoid cyst कितने टाइप्स का होता है, कैसे फॉर्मेशन होता है, पेशेंट को क्या प्रॉब्लम होगा, एज अ डॉक्टर व्हाट विल यू सी, इज dermoid cyst a true cyst, what are the features of true cyst, features of false cyst. Then we also studied कि common sites कहाँ होता है जहाँ dermoid present हो सकता है, and how will you manage a case of dermoid.